Hello everyone, I am Dr. Nidhi Navani. I am an Ayurvedic consultant. Today I will be discussing about ano-rectal diseases because generally there is a common notion in the society or in the public that any problem which is happening in ano-rectal area or anal opening, they term it as piles. But all anorectal problems are not just piles. Anorectal problem consists of different problems. It can be a fissure, it can be piles, it can be hemorrhoids, or it can be a pilonidal sinus, it can be an abscess, or it can be just a skin tag. So my first very important advice to everyone is, whosoever is watching this video, that please, if you are having any problem in your anal area, any pain in your anal area associated with a small mass growth or a small tissue growth with bleeding while passing motion, or after passing motion they have slight bleeding, or any pus discharge, please don't term it as piles and don't go to the medical store and immediately buy some over-the-counter medicines, because this is very common. What the generally people they will ask some of their relatives or their friends if they have undergone any of the problem like that, and then they will advise them to go to the shop and buy some medicines, or some ad in the newspaper they will see and buy some medicines. But with this medicine, what happens? Probably that pain will reduce, probably one or two symptom will reduce, but the problem remains like this. And after some time, as the time passes, again the problem reoccurs, and then the problem, it becomes multifold. Like if it's from the smaller pain to a bigger problem. At times, from a small fissure, it converts into a fistula problem. So, if anyone, my sincere request to everyone, if anyone is having any of these symptoms, any pain, bleeding associated with the pain or burning in their anal opening or in their anorectal area, please go to a doctor and get it examined. Because a good qualified doctor will first examine the patient and then identify what is the problem in that area, what is the problem in the anorectal area, and then give you tell you the treatment or the medicine according to the condition of the patient. It is never like any one medicine or one treatment suits all the patient, because every patient is different and every disease is different, and especially this anorectal diseases, they are completely different from each other. Now coming to fissure. What is fissure? Fissure is basically, suppose this is your anorectal opening or anal opening. So fissure is basically in this area, anywhere you will get a small cut or a deep cut associated with pain or bleeding, with burning while passing motion or after passing the motion. The patient at times is not able to sit for longer duration because there is a continuous discomfort and a continuous burning sensation in that area. So that is fissure. And fissure is totally very different from a hemorrhoid or a pile mass, because pile mass will have some sort of growth some sort of tissue growth, like either it can be internal or external, and it can be located at different positions like 3 o'clock, 12 o'clock, 9 o'clock. So hemorrhoids or pile mass or fistula are totally two different diseases. Then there is a third very common found problem in the anorectal area is fistula. Fistula is a infected tract which forms at the opening of anorectal area. What happens? Fistula is a tract which will have one opening in just near to the anorectal area, and the second opening will be inside somewhere in the anal canal. So that is a totally different disease, and it is associated with lot of pain, pus discharge and blood discharge at times. So my first advice to anyone who is undergoing any of this problem or is having any of this symptom is, please immediately go to a good qualified doctor, get yourself thoroughly examined. The doctor will probably do a proctoscopic examination, a digital or a manual examination, or if required then probably scanning will be done to further identify the problem. So it is very essential for any person who is having any of these symptoms or problems, immediately please go to the qualified doctor, get yourself examined, and on the basis of the examination, when your disease is identified, then the doctor will be in a correct position to tell to explain your problem and give you the correct treatment for your problem. Thank you.